Hello, my name is Haley Barefoot, and I am a fourth-year medical student at the University of Miami. Today, I will be presenting a case that involves a child with a recurrent, unexplained abdominal pain that was likely associated with a long-standing history of abuse. I met this patient when they were admitted with complaints of abdominal pain and intractable vomiting. Initial workup was unremarkable. The patient's vital signs and lab values were all within normal limits, and there were no witnessed episodes of emesis since being admitted. As the team continued to search for causes of the patient's pain, the patient's mother became dissatisfied and requested that the patient's gallbladder be removed. An ultrasound and HIDA scan were performed, both of which demonstrated no significant findings. After it was explained to the mother that the results from both tests were normal, the mother still insisted that the patient's gallbladder be removed. At this point, an extensive chart review was performed, and it was discovered that the patient had been seen dozens of times for similar symptoms, each time undergoing extensive workups with invasive procedures. No organic underlying cause was ever identified. It was also discovered that the patient had an extensive history of physical, sexual, and psychological abuse by multiple perpetrators over a period of several years. During multiple admissions, it was suggested that the patient's symptoms may be a psychosomatic manifestation related to their history of trauma. The psychiatry and psychology teams were consulted on multiple admissions, and on at least one admission, it was suggested that the patient's symptoms were likely due to somatization of mental health concerns, and it was recommended that the patient receive a thorough psychiatric evaluation. However, there is no documentation that the patient ever received a full psychiatric evaluation, and on multiple subsequent admissions, the patient's mother refused to speak with any psychologist or psychiatrist, instead requesting that the patient undergo more invasive medical procedures. This case is important to discuss because it highlights an ethical challenge that is unfortunately not uncommon. While it is important to complete an adequate medical workup of symptoms thought to be psychosomatic, there is a point at which continued exposure to radiation and risk of invasive procedures becomes outright harmful for patients, especially when that patient is a child. So, how should we address such patients? I believe one way to improve care for patients such as these is to increase awareness of the common physical manifestations of psychosocial trauma. There's extensive research on the gut-brain axis and several of the more common physical health effects of trauma and abuse. While there is not an easy solution to managing patients whose care involves ethical dilemmas such as these, we hope that by presenting this case, we can bring awareness to these types of challenges and create space for a dialogue regarding how to navigate such situations.